Welcome back to the channel. So today we're doing a scenario. We're going to be doing several of these scenarios in different settings so we can take some of the skills and knowledge that we have taught in past videos and applying those in a real world situation. So today we have a scenario that is a bleeding control scenario, and before I give too much away, let's jump in and take a look at that scenario.
Hey man, are you okay? Oh, hold direct pressure right where it's bleeding, okay? Looks like you've lost a lot of blood. I'm gonna stick this tourniquet on you, okay?
Alright.
Alright, I'm gonna tighten this up, okay? All right, I'm gonna need to expose your wound to make sure there's no more bleeding, okay? All right, looks like the bleeding stopped.
So without making the scenario too graphic or gory so that this can be relevant to anybody, including children, we took a scenario of someone that is logging or cutting firewood with a chainsaw. They're not using proper protective equipment. They end up cutting their leg, and now we have an issue of severe bleeding that needs to be addressed. So let's start from the basics here. First off, prevention is the best medicine. So if we are preventing these injuries in the first place by wearing eye protection, ear protection, chaps, all these protective measures that can reduce the chance of injury, this will help prevent the need to actually have to apply a tourniquet. So as always, prevention is the best medicine. So we can do our best to stay safe, but you may be rendering aid to someone, like in our scenario, that was not staying safe and did not have proper protective measures in place. So the first thing you have to do as you're now rendering aid to someone is to make sure that the scene is safe. Make sure that the chainsaw's not running. Make sure that heavy equipment's not running. Make sure there's not a tree about to fall on you as you come to render aid to this person. So we have to make sure that the scene is stable, because if you go and approach the scene and start helping and a tree falls on top of you or something else happens that you were not expecting, now you can't continue to treat that patient and things are just going to get out of control and more chaotic. So we have to make sure that the scene is safe and stable, and then we can proceed to help the patient with patient care. Once we approach the scene, we notice that there is severe bleeding, and this is an immediate life threat. This is a deep cut to the leg. This is bright red blood, which means that it's an artery, which is going to bleed out much faster than a vein. We can lose a large amount of blood from an arterial bleed. This needs immediate direct pressure. Now, the rescuer in this scenario opted to have the patient, who was still responsive, apply their own direct pressure to the area of bleeding so that the responder now can put on some gloves, some proper PPE, and have that in place before he goes to treat. Now, if this is a family member and you're willing to treat without putting gloves on, that's going to be a decision that you yourself make. But for the sake of this scenario, we opted to have the patient hold direct pressure, the responder now to put gloves on so that they have isolation from that injury. One thing that gloves do is prevent you from getting any diseases that that person has in their blood. And if you have any cuts in your hands, that blood can get into the sores or cuts in your hands, and now you can contract those same diseases that that other person may have. A second thing that gloves do is also prevents all the nasty dirt and mud and grime and everything else we have on our hands while we're out in the woods from getting inside that person's wound if we were to take our hands without gloves and put them directly in the wound to try to stop bleeding. Now that we have gloves on and that barrier in place, the next thing we want to do is address any life threats. Severe bleeding is a life threat, and severe bleeding on an extremity is controlled by a tourniquet. Proper tourniquet placement is 2 to 3 inches above the wound. Or if it's a large wound or you're not exactly sure where the bleeding is coming from because the clothes are saturated in blood and it's hard to see exactly where the injury is, just go all the way up on the arm or the leg, apply the tourniquet tight, and make sure that the bleeding has stopped. Once the tourniquet is in place, we've pulled it tight, we've tightened the windlass down, we want to double check to make sure that bleeding truly has stopped. So you'll notice in this scenario, he exposes the wound, he takes some trauma shears and opens the wound up to make sure there's no further bleeding. Now that we have the bleeding stopped, the immediate dangers are stopped for a moment, the life threats have been addressed, we need to make sure that we contact 911 and we have emergency response headed our way. If you have a second person on scene, they should be doing this simultaneously while you're applying the tourniquet. But in this scenario, there's only one person and the life threat of the severe bleeding was such of a significance that we needed to apply a tourniquet before we took 60 seconds or so to be able to call 911, give them a location, and tell them what happened. If you're finding this video helpful, leave us a like on the video. Make sure you're subscribed to the channel and turn your notifications on so you're alerted of future videos. And if you have any questions over anything we're talking about today, leave us a comment down below. Once we have the life threats taken care of and we have 911 on their way, the next thing we want to do is just a primary survey. We usually start this with what we call the ABCs, airway, breathing, and circulation. Make sure their airway's open, make sure they're breathing, and make sure they still have blood circulating around their body. That check can be done with a simple radial pulse check to make sure that you can still feel a heartbeat. Now, this person in this scenario is awake, alert, oriented, talking to us, so it appears that most of the ABCs are intact. The next step for someone that's trained, would be to go into a primary survey. And this primary assessment or survey is really looking head to toe quickly on this patient to see if there's any other injuries. The large amount of blood from the lower leg is what we would call a distracting injury. It is a severe injury, but once it's addressed, it can distract us from other injuries that may be present. Maybe they nicked the other leg with the bar of the chainsaw. Maybe they fell and hit their head afterwards. We haven't done a full assessment, so now is the time to look at that and see if there are any other injuries that we need to address. Following the primary survey, this would be the time where a trained responder can start to take vital signs, perform any other treatments, go ahead and apply gauze to the wound and wrap that with gauze to keep any debris or dirt from getting inside that wound, keep the tourniquet in place, but we're also now wrapping that wound as well to try to keep it clean. After this, the only thing left is really to get this patient out and have them monitored while they're en route to a treatment facility. In this scenario, we have the responder helping the patient into a vehicle to take them to a road to meet an ambulance. Well, that wraps up our scenario. Hopefully this was helpful for you to be able to see some of the skills and tactics now applied in a real-world situation so you can see the flow of this on how it goes from start to finish. If you have any questions over this scenario or have any scenario ideas that you would like to see in the future, leave us a comment down below and let us know. Well, that's it for today. As always, stay vigilant and stay safe.